So, when was the last time you had your blood pressure checked? New guidelines have completely redefined what it means to have high blood pressure, and it puts millions more people in the spotlight for a condition that, well, often has no symptoms at all. Today, we're going to break down exactly what this means, especially if you're also managing diabetes. All right, let's get right about what exactly changed. Well, this new health alert is all about a lower number, a lower threshold for diagnosing high blood pressure. Let's take a look at what that new number is, and more importantly, what it could mean for you. Okay, so here's the new rule of thumb. The condition we call hypertension, or just high blood pressure, is now officially diagnosed when you have a consistent reading of 130/80 or higher. Now, you might remember the old number, which was 140/90. The big deal here is that by lowering that number, the goal is to get people to start making changes much, much earlier. This table really lays it all out. You can see right there, anything below 120/80 is considered healthy, perfect. But once you hit that 130/80 range, bam, you've officially entered stage 1 hypertension. I think the most important thing to see here is that the warning zone starts a lot sooner than most of us thought. Just knowing where you are on this chart is really the first step to taking back control. All right, now we get to the real heart of this explainer, the powerful and frankly dangerous link between high blood pressure and diabetes. When you have both of these conditions at the same time, they create a really risky combination for your health. Let's dig into why.
Look, either one of these on its own is a big deal, right? Hypertension puts a ton of strain on your heart and arteries. Diabetes means your blood sugar is too high. But when they team up, they become a force multiplier for damage. They both attack your blood vessels, and that just dramatically skyrockets your risk for some really serious stuff. We're talking heart disease, kidney failure, even serious eye damage. And this right here, this is one of the biggest dangers of all. You might feel totally 100% fine. Hypertension is called a silent condition for a reason. So many people have zero symptoms. Sure, some might get headaches or feel dizzy, but you absolutely cannot rely on how you feel to know if there's a problem. That's exactly why checking your numbers regularly is so critical.
So, who really needs to pay close attention to this? Let's break down the key things that can increase your risk, especially when diabetes is already part of the equation. The risk factors really fall into a few main buckets. Some things you just can't change, right? Like your age or if high blood pressure runs in your family. But there are so many things you can control. Lifestyle is a huge one. Things like eating too much salt or not getting enough exercise. Same goes for habits like using tobacco or alcohol. And of course, having another condition like diabetes puts you in a higher risk category right from the start. Okay, enough of the scary stuff. We've defined the problem, we've talked about the risks. Now let's get to the most important part. What can you actually do about it? The good news, the really good news, is that you can manage both of these conditions. Here's a simple 5-part action plan to help you take charge. It all boils down to these 5 key pillars. It starts with monitoring your numbers and goes all the way to working with your doctor. Let's quickly walk through each one. Step 1, monitor, because you can't manage what you don't measure. For blood pressure, it's pretty simple. Just chill out for 5 minutes beforehand, make sure your arm is supported at about the same level as your heart, and, this is key, write down your readings. Same goes for blood sugar. Use your meter or CGM like you're supposed to. That written log for both is going to be gold for your doctor. Step 2 is all about diet, and the goals here are super clear. For sodium, you really want to aim for less than 2,300 milligrams a day. Following a proven eating plan, like the DASH or Mediterranean diet, is a great move. And if you drink alcohol, just remember the rule. A max of 1 drink a day for women, 2 for men. Step 3, get active. So what's the magic number here? It's 150. That's your weekly target in minutes for moderate intensity exercise. And we're not talking about running a marathon here. This could be a brisk walk, going for a swim, anything that gets your heart rate up. Just try to spread it out over the week. And for step 4, let's round this out with a few other huge lifestyle game changers. Finding ways to manage stress, like meditation or yoga, can have a real impact. Quitting smoking, that's non-negotiable. Nicotine just makes it so much harder to control your blood sugar. and maintaining a healthy weight is huge. Even losing just 5% of your body weight can make a massive difference. Okay, I need you to really listen up for this next part. No distractions. This is, without a doubt, the most critical information we're going to cover. Knowing these signs could save your life, or maybe the life of someone you love. So please, pay close attention. First up, heart attack. And it's not always that dramatic, clutch your chest scene you see in the movies. Yes, it can be pressure or pain in your chest, but it can also show up as discomfort in your back, neck, jaw, or even your arm. Feeling short of breath, nausea, or suddenly breaking out in a cold sweat are also major, major red flags. And next, stroke. The big word to remember with a stroke is sudden. A sudden numbness or drooping on one side of the face, sudden weakness in an arm or leg, sudden confusion or trouble speaking, a sudden severe headache out of nowhere, or sudden vision loss. So let me be absolutely crystal clear here. If you or anyone around you has any of those symptoms we just covered, heart attack or stroke, do not wait. Every single second counts. To wrap all this up, I think this quote from Dr. Daniel Jones really says it all. He was one of the experts who wrote the new guidelines. He said, prevention, early detection, and management are critical to long-term heart and brain health, which means longer, healthier lives. I mean, that's really what it's all about, isn't it? Ultimately, all this information is great, but it's what you do next that really matters. Your health is in your hands. So after hearing all this, what's the very first step you're going to take? Maybe it's checking your pantry for salty foods. Maybe it's scheduling that doctor's appointment you've been putting off. Or maybe it's just planning a 30-minute walk for later today. Whatever it is, the choice is yours.